Assalamu alaikum. I am Dr. Faysal Hawlader, lecturer, Department of Anatomy, Eastern Medical College. Today I am going to discuss about eyeball. What is eyeball? It is the organ of sight. Where it is located? Eyeball is located anterior 1/3 of the orbit within the fascia valvi. What is fascia valvi? It is the membranous sac. Now, what are the layers of eyeball? There are three layers: outer fibrous coat, middle vascular coat, inner nervous coat or retina. Outer fibrous coat is composed of cornea and sclera. Middle vascular coat is composed of from behind forward choroid, ciliary body and iris. And inner nervous coat or retina is composed of optical part and non-optical part. Now, outer fibrous coat. Outer fibrous coat is composed of cornea and sclera. That means anterior 1/6 is formed by the cornea and posterior 5/6 is formed by the sclera. What is sclera? It forms the posterior 5/6 of the eyeball. What are the structure pairs the sclera? Sclera is paired by number of structures: optic nerve, central artery and vein of retina, posterior ciliary vessel, anterior ciliary vessel, and there are 4 to 5 vena verticosi. Central artery of retina is a branch of ophthalmic artery, and ophthalmic artery is a branch of internal carotid artery. Now, what are the functions of sclera? It maintains the shape of eyeball. The spherical shape of eyeball is maintained by sclera. It protects the middle vascular layer and inner nervous layer. It maintains the optimum intraocular pressure, and it provides attachment of extraocular muscle. Again, what are the functions of sclera? It maintains the shape of eyeball. It protects the middle vascular layer and inner nervous layer. It maintains the optimum intraocular pressure, and it provides attachment of extraocular muscle. Now, what are the name of extraocular muscle? There are 4 recti and 2 oblique. 4 recti are superior rectus, inferior rectus, medial rectus and lateral rectus, and 2 oblique are superior oblique and inferior oblique. Now, nerve supply of extraocular muscle. All extraocular muscle is supplied by oculomotor nerve, that means third cranial nerve, except superior oblique, which is supplied by trochlear nerve, and lateral rectus, which is supplied by abducens nerve. We can remember it by a dictum, that means SO4 and LR6. That means all extraocular muscle are supplied by oculomotor nerve except SO4, that means superior oblique, which is supplied by trochlear nerve, and LR6, that means lateral rectus, which is supplied by abducens nerve. Now, what are the intraocular muscle? They are 3 in numbers: ciliary muscle, sphincter pupil and dilator pupil. What are the nerve supply of intraocular muscle? Ciliary muscle and sphincter pupil are supplied by parasympathetic supply via short ciliary nerve, but dilator pupil is supplied by sympathetic nerve via superior cervical ganglia. Now, cornea. Anterior 1/6 of the outer fibrous coat is cornea. What are the characteristic features of cornea? It is avascular. It is highly sensitive. It acts as a refractory media of the eye. It is avascular, so its nutrition is maintained by aqueous humor, lacrimal secretion and capillary bed. And it is highly sensitive, and it is supplied by ophthalmic division of trigeminal nerve. The facility of avascularity of cornea is transplant without any immunological reaction because it is devoid of blood vessel. And finally, it acts as a refractory media of eye. What are the refractive media? Cornea, aqueous humor, lens and vitreous body. Now, what are the structures of cornea? Cornea is composed of following layer, that means outer epithelium, then anterior limiting membrane or Bowman's membrane. Third layer is substantia profia or stroma, and fourth layer is posterior limiting membrane or decimate membrane and corneal endothelium. The outer epithelium is lined by non-keratinized stratified squamous epithelium, and third layer, that means substantia profia or stroma, it is made up of collagen fiber. Why cornea is transparent? Because of the smoothness of its lining epithelium, absence of blood vessel and uniform organization of collagen fiber. Now, middle vascular layer. It is also known as uveal tract. Layers of middle vascular from behind forward, choroid, ciliary body and iris. Choroid is also composed of so many layers: suprachoroid lamina, vascular lamina, capillary lamina and basal lamina. Now, function of choroid. It gives nutrition to the outer layer of inner nervous cord or retina. Now, ciliary body. It is also part of middle vascular cord. Posteriorly, it is continuous with choroid and anteriorly, it is continuous with iris. Now, what are the composition of ciliary body? Ciliary body is composed of ciliary muscle and ciliary process, and it provides attachment to the suspensory ligament of the lens. Now, what are the function of ciliary muscle and what are the function of ciliary process? Ciliary process secrete aqueous humor. When ciliary muscle is contracted, the suspensory ligament is relaxed and the curvature of lens then increased. Now, iris. What is iris? Iris is a circular thickening of middle vascular layer and there is a central apparatus known as pupil. What are the function of pupil? It controls the entry of amount of light. Now, composition of iris. Iris is composed of blood vessel, loose connective tissue and two involuntary muscle, that means sphincter pupil and dilator pupil. We know that sphincter pupil is supplied by parasympathetic supply via short ciliary nerve and dilator pupil is supplied by sympathetic nerve via superior cervical ganglion. Again, I repeat the middle vascular layer. Middle vascular layer is composed of choroid, ciliary body and iris. And function of choroid is it gives the nutrition of outer layer of inner nervous cord or retina. Ciliary body, it is posteriorly continuous with choroid and anteriorly it is continuous with iris. And function of ciliary process is it secrete aqueous humor, and iris, it is a circular thickening portion of the middle vascular layer and it has a central apparatus known as pupil. And composition of iris is blood vessel, loose connective tissue and two involuntary muscle, that means sphincter pupil and dilator pupil.